Hey everybody, it's Dr. Platt. Hope everybody's doing well and having a good week. Just want to share something with you all that I've been doing for quite some time, and it really makes my practice way more efficient as far as implant volume and patient acceptance. It also is helpful for clinical excellence, truthfully. So what I would recommend you do is train your implant treatment coordinator to do the implant exam from start to finish. At the end of my little video here today, we will have Monette do her exam for you, one of her exams for you, so you can see how she does it. And what you'll notice is I do come into the exam, but I'm only there for a short period of time. So what that does is it leverages my time so that I can do things that are productive. But it also gives the patient the advantage of spending a lot of time with Monette, who is an awesome resource for implant knowledge and way nicer than me, as I always say. The way we do it is we will schedule her own column, so she has her own room. So she has 2 implant exams in the morning and 3 in the afternoon. That allows her to do 5 a day with me, so I see the patients, of course, as well. So what I will do is schedule it such that I can do patients until around 9:30 or 10. And then she'll have one ready for me at about 9:30 or 10. Then I'll go back and do some more patients, and then she'll have another one ready for me at about 11. And then we start the whole process over at about 1 o'clock in the afternoon. I have another awesome implant coordinator by the name of Tanya that does the same thing for me. So it actually allows me to do as many as 10 implant exams in one day. And what I found is because Tanya and Monette can spend so much time with the patient, and I of course will spend as much time as necessary, but usually by the time they talk to my implant coordinators, they have all their questions answered. There are exceptions, of course. And patient acceptance is really high because they're so happy and comfortable with Monette and with Tanya. So hang on, we'll show you one of Monette's exams, how she does it. It's obviously a staged exam, so no questions are asked of her, but it kind of gives you an idea of exactly how she does things, and I think it's a great idea. So it allows the patient to get more time. It allows me to do the productive things in the office, but it also allows us to keep patients scheduled and keep our referral base happy, so we can continue to see their patients on in a timely manner. So thanks very much for watching. I hope you enjoy Monette's exam.
And what I'll do today for you is we're going to go ahead and go over the procedure with you that your referring dentist has sent you over for, and then of course you'll meet with Dr. Platt as well. Okay, so the first thing I'm going to do is just explain to you and show you what a dental implant actually is. So a dental implant is a titanium screw, and what it does, it replaces the root portion of your tooth. Okay. And since it is titanium, they do not decay, and most importantly, it preserves bone. Okay. So with that said, Michelle, we'll go ahead and we'll discuss this upper All-on-4 for you. And then before this procedure could actually be done, there's a lot of work and a lot of behind the scenes that your dentist would actually be doing with a dental lab. Because throughout this process, we would be working very closely, not only with the lab, but also with your dentist. So what would happen is the day of surgery when you do come in, generally patients go to sleep for this. While you're sleeping, Dr. Platt will remove the teeth, and then he's going to do a bone reduction. So Dr. Platt will actually kind of remove some of the bone that you currently have. At that point then, Dr. Platt will actually strategically place 4 dental implants. Once Dr. Platt is completely done with placement of the implants, he will then put of course, stitch everything up and put your sutures in place. This generally takes Dr. Platt roughly 2.5 hours to do. Again, the entire time you're going to have that sedation. When Dr. Platt is completely done with surgery, at this point he's going to wake you up out of the anesthetic. Keep in mind you're going to be completely numb, you're going to be very comfortable, but we also need you to be coherent, because at this point then Dr. Platt will actually step aside and your dentist in the lab will actually be, we call chairside, so they're going to be chairside with you. Okay. At that point then, your dentist and the lab will put these little attachments on, which are called abutments. Once they put the abutments on, they're actually going to modify an upper denture, which is they're going to send us ahead of time. So with that denture, they're going to modify that denture into a horseshoe. And this is exactly what it looks like. And once the abutments are placed, your dentist in the lab will actually insert the temporary for you, and they're going to screw this in position. With the little screw access holes, actually they'll cover that up for you before you leave, so of course it's not going to be visible to you. When you leave though with this in place, keep in mind it's a temporary denture. So you are going to be on a restricted, softer diet for approximately 3 months. So anything that crunches and makes noise, you have to avoid, because again, you don't want to crack or break this. If you do, it's going to be a bad day for everybody involved. So please be diligent and follow those guidelines. During the healing phase, again, which is going to be approximately 3 months, we'll have you pop in every now and then to keep an eye on it. One of your checkups here, Dr. Platt will actually give you a water pick. So you're going to take the water pick unit, be diligent about using it a few times a day. Okay. So when you have this water pick, it will be your best friend. Because again, keep in mind, this is non-removable. It's screwed in position. So when you get home, you're going to take your lip and you'll kind of raise your lip up. You're going to take the nozzle of the water pick and you're going to just let the water flow all the way through. So you'll adjust that and periodically move the nozzle and let everything run through. Okay. Again, let the lip come down, rinse your mouth out, and again, your dentist will actually have you care for the teeth itself, but it's very important, again, we have to keep the tissue pink and healthy and be diligent about your water pick. After 3 months, Dr. Platt will do a final check to make sure that the implants are completely healed. At this point, then, we're going to dismiss you back to see your dentist. Your dentist at this point will actually take an impression to have your final teeth made. So the dentist is going to carefully remove the temporary. He's going to take one more impression. He will then carefully screw this temporary back in. So again, you're still going to be on that soft diet. After the impressions are taken, your dentist will actually send everything off to a dental lab. The dental lab at this point then will make your final teeth. Usually takes, again, maybe a few weeks, if not a little bit longer, for them to make the final teeth. So your last appointment with your dentist, one last time, he's going to carefully remove your upper temporary. Okay. At this point then, he's going to carefully attach and screw in position the final teeth. And again, keep in mind the little access holes will be covered up by your dentist. So underneath these permanent teeth, the final teeth as we call it, there's a titanium bar. So that's what makes the substructure on this extremely sound. And then after surgery, of course, you always want to make sure that you're diligent with the antibiotics that Dr. Platt does give you. He'll actually keep you on antibiotics and pain meds. And then with the all-on-4, especially on the upper, patients have a tendency to get a little puffiness, maybe for a few days. So please don't panic if your face is puffy, even up to your eyes. And we've seen that happen. So it's just real important for you to kind of lay low and take it easy for a few days after surgery. So if you don't mind, we'll go ahead and we'll let Dr. Platt know that we're ready in here. And if you have any additional questions, please feel free to ask. Okay. And then after he exits the room, then what we'll do is we're going to have you sit up here at the desk with myself. We're going to go over some paperwork. If you have any insurance questions, I can certainly help you with that.
Okay.